Welcome everyone. Thank you for taking time out of your busy schedules to take part in what we hope is a really thought-provoking and stimulating webinar about adult social care and what next for transformation of adult social care. So welcome and thank you for taking part. You might have noticed by now that I'm not Paul Burstow. Unfortunately, Paul Burstow has actually had to go into hospital. He says he's fine. He's got an infection in his eye, and he just cannot get back in time to chair this session. So I'm standing in for him today, and will be chairing the session for the remainder of the webinar. Just in terms of introductions, I'm Ewan King. I'm the Deputy Chief Executive of the Social Care Institute for Excellence, which is a national charity, been around for about 20 years and devoted to evidence-based improvement in adult and children's social care. I'm really pleased to be able to chair this session today. And I'm also really pleased to be able to introduce a fantastic group of speakers. We've got Iain Baine, who is the Director of Adult Services and Wellbeing in Calderdale Council. And he's going to be joining us and talking about his experiences of trying to drive transformation in adult social care and what has been so far a very, very challenging year. We're also joined by John O'Haran, who heads up consulting services at CIPFA, a charity which is well known out there as one of the leading organisations, if not the leading organisation on public finance, and also Maggie Kenney, who is the Chief Executive of Peopletoo, and we're really pleased to be able that she's able to join us as well today. Okay, so before I ask Iain to speak, I'm just going to make a few introductory comments. I don't think there is a speech, a webinar, an article right now about adult social care that doesn't talk about the unprecedented nature of the challenges we face. Before COVID struck the sector, adult social care was already facing an uphill struggle. Finances were already very challenged. The financial settlement for adult social care was already not seen to be good enough, and we were facing as a sector rising demand and ever more complex demand. So this was already placing enormous strain on the sector. And then along came COVID-19 in the spring, and we all know how grim the consequences of that were for the sector. We saw just far too many deaths in care homes, far too many care workers died, trying to provide the best available care to people. So it's been a very, very challenging year for the sector. And unfortunately, as we probably all have noticed by now, we are seeing a rise in cases of COVID-19 again as we enter the winter period, and that places yet more strain on adult social care. So it's really been quite a challenging year for everyone involved in adult social care and support. About a month ago, SCIE published a paper on the future of adult social care called COVID-19, New Thinking on the Future of Adult Social Care. And that was the report based on our engagement with a wide range of leaders from across the sector, frontline staff and people who use services and carers. And one of the big statements that we made in that report was that although we face enormous challenges, we actually need to be bold. We can't simply go back to where we were before. And actually we have a window this year and into next year where we have to really grasp the nettle and try to drive through better way of delivering care and support to people. So we have to be bold. That was the first message. We also talked about the need for free shifts to take place in adult social care. The first shift we talked about was the need for the government to make a decision on the future funding of adult social care. We need a decision. We need a long-term plan for how the sector is going to be funded. And yesterday, a number of us are probably already trying to decipher what Boris Johnson meant about the magic of averages to pay for adult social care. But clearly, he is still looking at how we can have a long-term financial settlement for adult social care. So that was the first shift. The second shift was about moving our services, moving the way in which we provide care and support away from being reactive, away from being largely institutional in our approach, largely hospital-based in our approach, towards being much more focused on prevention and providing services within communities and tapping into the resources, capabilities and strengths in communities. I'm sure Iain will pick up on this theme as he talks about what he's trying to do in Calderdale. So really trying to adopt that strengths-based approach. And then the third theme was about the workforce. For too long, the workforce, I think we'd all agree, has been underpaid, undervalued, and we need to move towards a parity of esteem for the workforce in relation to their colleagues in the NHS. That means better pay, better conditions, and a clear career pathway for people entering the profession. So that was the report that we published earlier in the year, and I think that the circumstances, if anything, have become more serious since. But there's still need to get on with delivering improvements and better care, and that's what we're going to focus on today. This is the second of these webinars. The first webinar, we actually talked about the broad framework, the broad challenges that we face in trying to improve care and support. Today, we're going to try and get into the detail of how we actually go about delivering transformation despite all the challenges that we face. So I'm going to stop talking now, and I'm really delighted to be able to hand over to my colleague Ian Baine from Calderdale, who's going to talk about his experiences of leading care and transformation. Thank you.
Ewan, just before you do, it's Steve, your colleague here from the Social Care Institute for Excellence. If you've got questions, folks, do send them in on the questions tab, and we'll be answering them as we go along. So look at the questions tab, type them in, and we'll pass them on to the panel. Sorry about that, Ian.
It's okay, no worries.
Thanks, Steve. Yes, do keep the questions coming in. Thank you.
Ewan, you did a bit of a good job for me, because actually I was going to start off by talking about, in order to transform, it would be amiss of us to not highlight the need for a national decision on how we're going to fund a long-term future of social care. Because without a long-term funding solution, we will simply not survive. So I think there is something about recognising that a lot of what I'm going to talk about today in terms of how we transform adult social care has got to be predicated on a long-term, and completely agree with you. And I think I'm immensely proud of what adult social care and local government have done during COVID. I think we have moved mountains, and I think for too long we've been the adjunct to NHS and social care, and I think we've had time in the light to people to really understand some of the complexities that social care deals with. I think the other part of what Ewan was talking about was the importance of workforce and recognising the true value of social care. And again, I kind of would reiterate the need for a national workforce strategy for social care. It is for a sector not to have a workforce strategy. I feel we can't defend that. So we do need a national strategy for social care in terms of the workforce. But rather than me go onto my soapbox, what I'll probably do is talk to you a little bit about Calderdale and what we're trying to achieve. And some people, when I talk about Calderdale, they kind of wonder where Calderdale is, and I've had it's ranged from it's in the Scottish borders to surely it's just a sleepy old village somewhere. So Calderdale's a metropolitan authority. In population terms, it's probably the smallest Met. It's only 210,000 population, but in geography is one of the largest. We've got villages, towns, urban and rural areas, and obviously delivering social care in that kind of geography is always challenging. So I think we have been thinking for some time around what we want social care to look like in Calderdale. And I think as part of our overall approach, we've got a council ambition, which we encapsulated as called Vision 2024. And there's some very simple words that describe what we want Calderdale to be by 2024. We want it to be a place that's known for its kindness, its resilience. We want to nurture talent and enterprise, and we want to be distinctive. And in some ways, Calderdale is distinctive in the sense that most people who have never come across Calderdale will probably think it's somewhere between Last Tango in Halifax and Happy Valley. It's probably somewhere in between those two places. But I think the journey we've been on in terms of what we've been attempting to do, and this will be, it'll be common to many places around the country, is we've started to have some conversations about strength-based social work practice, understanding that the people that we work with and we serve, we've for too long dealt with a deficit model, So there's something about how do we create a cultural shift and practice to recognise the strengths that people have. Alongside that, in a twin track, we've also been working with our commissioners to do outcome-based commissioning and around connecting people to their communities. You can have the most sophisticated conversation around strength-based work, but if all we have to deliver is very traditional social care responses, we won't really transform the way that people live their lives. The way in which we want to achieve Vision 2024 is that everybody can live that larger life. So if we get the components right around strength-based practice and around asset-based practice to connect people to their communities, we believe that we can have quite an impact on the way that adult social care has delivered. I think there are things that we do in our practice that often we can take too long to do our assessments, and we don't intervene early enough and engage in the individual with the solutions they want to make. So I think one of our key elements of practice is to ensure that we've got an effective early intervention and prevention approach embedded into all the work that we do. I think one of the things that COVID has probably shone a light on is that most local authorities, and mine included, have had a market position statement, a document that kind of describes the social care model in terms of providers it wants in its patch. I think we will need to radically look at the kind of provision that's needed to support people to live independently. For finance people out there, I probably spend, and if my Section 151 officer was on this webinar, and he may be, he'd probably be saying that adult social care is one of the biggest spenders in the council. And one of the worrying things that we've got is I probably spend about 52% of my budget on older people services, so people over 65. And at any one point, we're probably supporting around 3,000 people. The converse of that is we probably spend about 40% of my social care budget on people of working age. And we're probably supporting at any one time between 700 and 800 people. So it doesn't take a mathematician too long to work out that if we don't have a different approach, for example, to working age adults and help them to be economically resilient, that actually there will be a drain on services if we continue to see that. And each year we see that percentage shift of spend on working age adults increasing. So we do need a way of engaging with service users, not to be service led, but to look at how we can support them into employment and their broader well-being. One of the things that we have also been doing, and it's building on a rich community connection work in Calderdale, is to both approach physical and emotional well-being and tackle loneliness. So we've been fortunate that we've been working with Sports England around an approach called Active Calderdale to try and engage all people to become more physically active, but also to connect with people to tackle loneliness. And I think that if we are to defer people needing social care for as long as possible and to maintain their physical and emotional well-being for as long as possible, we need to keep that work going. The other element of work that I describe is around embracing technology and making sure that we're maximising the use of technology and digital to connect people and support people effectively. I think there are things that I can remember from my social work practice, which is a number of years ago, where you could recognise a support plan based on a number of home care hours and calls. We'd probably attach a key safe to someone's door, and all those things build in a level of losing the loss of conditioning. So increasingly what we do is we build into our commissioning practice work that actually doesn't support the person to be mobile and to be physically active. So I think there's something about how do we embrace physical activity in our support planning, but also make sure that people are connected to communities. Clearly, COVID has created a real challenge for loneliness, because often we've asked our most vulnerable to stay at home and protect themselves. So the importance of digital in our journey becomes ever more important. I think one of the things that we are hoping to achieve, and I think we've still got a little bit of way to go, is to make sure that at the centre of this, the person's voice is consistently heard, and that we integrate a range of services around them. And that isn't just health services, it isn't just social care, but we need to take account of the environment they live in. So integration without, for example, housing involvement is quite a key issue. I think one of our big transformation challenges at the moment is that with the potential of COVID being with us for the next 6 months, and in some ways being focused on dealing with the here and now, and I think we're going to have a pretty tough winter this year, is having the headspace to focus on transformation. And I think part of the journey is about how we use our time and energy, one, to keep people safe through COVID, but making sure that we do have enough time to make sure that we attend to designing a future operating model that isn't just led by professionals, but shaped by the people who need those services. I think I'll pause there if that's okay, because I think I've probably taken up my 8 minutes.
Thank you, Ian. No, that was a really helpful set of comments about how you're going about trying to transform adult social care in Calderdale. Are there any questions from the audience? I know that Maggie, you have a question actually. That would be really helpful if you could ask. That'd be great.
Yeah, I'm just really interested in, because I mean, obviously it's really interesting to hear what's happening in Calderdale, and Calderdale is I guess like a lot of local authorities at the minute, benefiting from the real momentum that has been created by COVID in terms of the response by communities, voluntary and community sector. I'm just wondering, have you thought beyond COVID how you will maintain that momentum to ensure that some of the rich resources that we've been able to draw on during COVID are not lost?
Maggie, I think that's a really important point that you make, and we have put some thought to that. I think one of the things we are experiencing, we did have a lot of people come forward, and how our third sector was really central to our ability to respond effectively to the first wave of COVID. What we are experiencing is that a lot of the people who volunteered, and we had a whole series of volunteer hubs based around the 5 places of Calderdale. A lot of those, as the people have gone back into work, some of those volunteers are no longer volunteering. But I think what we have done is kept quite a rich vein of volunteers who we will be utilising going forward. I think we've created a very different conversation, which is one around partnership and collaboration. And I think what we're starting to see is people thinking about how as communities can we respond to these crises. I'm reminded that when COVID hit, and I'm not pleading the difficulties that Calderdale has, but we're also quite known for flooding. So we'd had a series of floods in February, and I think we had about a week out of crisis mode before COVID hit. And I think there is something about the resilience that communities have got, and if we can harness that and get into that kind of good neighbour approach, I think we can see a brighter future.
Great, thank you.
Thank you. That's really helpful. Thank you. Okay, so I'm going to ask Maggie now to talk about an approach that that we've been developing with CIPFA and Peopletoo, which aims to help adult organisations develop robust plans for getting through not only the COVID period, but actually transforming services at the same time. So I'm going to hand over to Maggie, who's going to talk us about that.
Great, thanks, Ian. So yes, so I'm really going to introduce everybody to the blended diagnostic approach. So people, CIPFA and SCIE have come together to develop a blended approach to transformation. And we believe that there are 3 critical success factors to sustainable and effective transformation. So the first one is around services, the right target operating model to manage demand and outcomes, but supported by the right commissioning strategy and approach, and enhanced by the right digital approach. So I'll discuss that in more detail around the kind of universal services, the targeted intervention, and the outcome focused long-term support. The second is around people, so the right practice, looking at obviously strength-based, which Iain was talking about, the right culture, behaviours, and the right people, so the right skills and capability and capacity within the workforce. And then finally, which is around financials, and obviously having that robust financial forecasting so that year on year you're not kind of putting a finger in the air around your growth, etc., and having that robust budget setting that goes with good forecasting, but also the right monitoring. So in terms of who's going to cover what, my colleagues John Halloran is going to cover finance, and Ewan Kenney is going to cover practice, and I'll focus on the target operating model. So Steve, can we move to the next slide, please? Okay, thank you. So this is probably something that a lot of you are familiar with, and it's a model that we continually refer to in Peopletoo. And basically we consider to be best practice in demand management. So if we look at kind of tier 1 that we call it, which is around the universal offer, something which Iain focused on in his kind of speech just now, is around looking at managing 70% of demand in what we call that universal offer. And to get that right, you know, we need to be looking at easy access so that people can easily access those services, that actually community-based services are reflected in there so that we can actually reflect the needs of a local community. And it shouldn't be seen to be done by the council. The council can obviously be the facilitator in this, but it really should be driven by communities and voluntary and community sector, which I think we have started to see with COVID, which is why I was quite interested for me in about how we, in his view, sustain that kind of momentum. And it is, I guess, also the council's role to harness those valuable resources. So as a facilitator, bring that together, you know, looking at health, public health, housing, as well as voluntary sector and communities, but also having some really mature conversations. And I think that has started to happen as well, in terms of really looking at those different organisations in partnership rather than a traditional kind of commission bureaucratic relationship. And I think that is really critical. If we look at the next tier, which is around the kind of targeted and sustainable intervention, we would be looking around 20%, to manage around 20% of demand in this space, really. And Ewan will talk further about the practice and behaviour, which is crucial here. But if we are going to look at a blended approach to targeted intervention, then we need to respect the skills of the workforce required, and actually also respect that it is quite a skilled job to come up with outcomes and solutions and work with individuals to achieve this. But again, partners need to have a mature relationship and recognise the skills they bring to a blended approach. I think there is a risk here that often we think a multidisciplinary can lead to one person doing everything. And I think we need to recognise that different organisations have different skills, and how can we work to people's strengths to deliver the best outcomes. And also, I think we're at risk here of forgetting about the sustainability of outcomes. We hear about that targeted intervention being quite intense for a period of time, and then people kind of dropping off a cliff when that intervention stops. And this is again where we can step people back down into universal so that they can actually have the support networks to maintain some of the outcomes that have been achieved. And then finally, we look at tier 3, which is around the long-term outcome focused provision. And here we're looking at around managing 10% of the demand. What is crucial here is self-directed support, people being able to buy what they want. But to achieve that, it's critical to balance market sustainability with choice. And I think that's a challenge that a lot of commissioners are facing. But the evidence shows that personal budgets drive creativity, which actually is seen to improve outcomes, but also reduce cost. But need to work with providers to develop the flexible models which meet the needs of the community, but also maintain a sustainable commercial model for those providers. And then we look at digital enhancement. And it's quite interesting that I think every kind of view of digital and what digital brings to social care is quite varied. From the traditional kind of assisted living technology, telecare, to, oh, we've got a new website, to we've got a new front door. And I think really what we're saying here is that digital should be a blend and should be mainstreamed over everything. But don't assume it's going to solve all your problems. It's part of a solution. But key to the use of digital is to design it with data intelligence, to actually understand the context of what you're trying to resolve, and not just think that digital will just plug in and resolve everything. And this is where user experience is really critical, to understand exactly what you are trying to resolve and the challenge and barriers that exist in accessing services and improving outcomes. And simple things can work. It doesn't always have to cost a lot of money. A new form on a website or a new page or a new space on a website can actually really improve access for people, improve their experience, and also improve the actual overall outcome. And I think also a key thing to note that if it doesn't support the target operating model that we've outlined, it probably isn't worth doing. And I think that is kind of a crucial piece of advice, I think, from ourselves. So I've outlined kind of the service approach to our blended approach to sustainable transformation in adult social care. So I'm happy to hand over to you, Iain, now to talk about the strengths-based.
Yeah, thank you. So as Maggie's already suggested, it's absolutely crucial that you have the right leadership, the right skills, the right capabilities in place if you are to improve, transform, and ensure that services meet the needs of different people within communities. So it's absolutely crucial that as part of this diagnostic, we would have an in-depth look at where the organisation currently stands in relation to its leadership, to its skills, to how people are currently organised. And what we would do to help us with this is draw on a new diagnostic tool that we've been funded to develop by the Department of Health and Social Care. And this tool looks at how organisations currently stand in relation, where they currently stand to strengths-based practice. It's been developed with social workers, with other social care practitioners, and with people who use services and carers. And it basically covers a number of critical dimensions that are needed in order to deliver a whole service, whole system approach to strengths-based practice. There are 10 dimensions. They cover elements like leadership. Do you have the right approach to leadership in place? 5 strengths-based approaches. It looks at co-production. Are you working collaboratively with citizens, with people who use in order to design services in the most appropriate ways? It looks at whether you have the right processes, forms, case in place. Do you have the right IT systems so that you are well placed to deliver productive strengths-based practice? It looks at partnership, working in collaboration, and helps you assess the extent to which you're doing that effectively. So it covers a range of dimensions. What we do is we use this tool through conversations with leaders, with the leadership team, with practitioners, and with service users in order to gauge where the organisation is in relation to those dimensions. And then that data, the data that we draw together from size, is triangulated against the work that Maggie and her team would do, and John and his team would do in relation to the finance and the target operating model. So it provides a rich understanding of where the organisation is on its skills, leadership and capabilities. I'm going to hand over to John now to talk about the financial dimension of the.
Thanks, Ewan. So finance. So why CIPFA joining with SCIE and Peopletoo? As Iain said in his presentation, social care is by far and away the largest spend in the council. There's already been 10 years of austerity. There'll be more. The finance environment we're operating in now is not going to get any easier at all. Therefore, whatever solutions you have and however the target operating models work, we need to look at the cost of them and how they're supported. So we also believe that there needs to be new and different target operating models for finance in order to support the way that you deliver services on the front line. So from a finance perspective, CIPFA sets the standards for accounting for councils. We also have done a lot of work around reorganising finance organisations across the piece in order to meet the demands of the environment that we currently live in. So in terms of the target operating model that Maggie's put forward, that Ewan has talked about as well, we think there's 4 areas in social care that need to be addressed. So there's managing pressures, there's delivery of savings, there's debt management, and there's strengthening financial oversight. So a lot of this is actually down to the nitty-gritty. A new target operating model, a new TOM, it needs to address the financial issues, and you need the finance function to be geared up to support it in terms of the delivery of those frontline services. So on managing pressures, as Iain and Maggie have both referred to, and Ewan, this is a demand-led service. So you need to look at how you deliver going forward. One way of looking at that is looking at the budget variations and the analysis that's been done. Review the accounting and the mechanisms and the processes that are in place for forecasting. That's one of the key areas. There's no point trying to change things when you get to the end of the year. You need a system and you need finance to be able to tell you as soon as you're going either overspent or underspent. And they also need to be able to forecast realistic actual costs. It's also worth making sure that the finance can give you comparative costing so that they have access to benchmarkings, the benchmarks, they have access to best practice elsewhere. They can tell you why things, if you say, well, how come they're doing it cheaper, they should be able to answer that and give you proper, accurate financial data. They need to look at and be able to help you with the cost drivers. You know, again, it's not just about what are they and how much are they costing, it's about the timeliness of that. It's how are they being controlled? Are they being controlled in time to make a difference to the delivery? Does your systems, do the processes that they provide for you, do they help you manage? Do they support you? Do they, rather than just monitor you? So in a way, that's very much around day-to-day operations. In terms of delivery of savings, in the environment that we live in, you know, as much as we'd like it to, savings won't go away. It's a fact of life. You know, chief executives, Section 151s are constantly under savings issue. So again, it's learn from experience, understand, get them to be able to tell you, you know, how savings were delivered in the past, what stopped, what were the barriers to delivering savings, what could be done differently from the finance perspective.
Sorry, John, I'm just going to ask if there's any panelists who haven't got mute on, please put mute on. Thank you. Sorry, John.
Okay. Again, it's also about getting them to be realistic in terms of having plans. learn from others, learn what's happened elsewhere. And do you have in place mechanisms to monitor savings and the plans properly? Third one is debt management. In terms of adult social care, there's always debts. Again, it's about actively managing the debt. It's about focusing on the areas where you can get paid. There's a lot out there at the moment around ethical debt management. Again, it's easy to take advantage of it. You need finance to help you do that or get them to do it for you. And finally, the thing I would highlight is strengthening the financial oversight. It may be slightly controversial, but you know, how financially aware are your current frontline staff of the costs of what they're proposing and the options that they have? Does finance support them and give them fully costed different options? Do they have that up-to-date information? And again, I'll come back to, is finance supporting you or just monitoring you? You need to get them to own the issues with you. It won't work if one does it and the other doesn't. They have to be jointly owned. That all implies a different way for finance, which should then support the way that the TOMs operated and as Maggie has outlined it here. That's why, as three organisations, we've come together. We all believe we're experts in our field. We've joined to support the sector on this because we believe that to be successful in the delivery of the frontline services, the council needs to work together. And in working together, it needs a blend of the skills that you see in front of you today. So we're happy to take any questions, happy to hand back to Ewan.
Thank you, John. Sorry about a bit of feedback there, with noise in the background. We're just trying to find out what's causing that, and we'll try to resolve it. So sorry about that. Okay, so I think there's one question from Joanne. Thanks for your question, Joanne. And I think this is about the TOM demand model that Maggie talked about. And the question is about the percentage and what that's based on. Is it investment, number of people, or something else? Maggie, do you want to take that?
Yeah, I will do. Yeah, the percentages are based on people. So the demand coming into social care, where we would be looking to manage that demand. So 70% of that demand at what we call kind of the universal kind of first point of contact, or even pre-contact, but guiding, signposting, supporting. And then obviously the 20% where it's more targeted intervention, but probably short term. And then obviously the 10% looking at long term. So it's a model we kind of use to gauge how effective our prevention, our first point of contact is, how successful and effective our intervention is, and then obviously moving into long term. So it's kind of a model we use when we go into local authorities to kind of gauge how they are managing demand against that.
Thank you. I was actually going to ask you, Iain, if you had any reflections on particularly the finance challenge and what you're doing to try and just keep as much on top of that as you can.
Yeah.
Any reflections on that, Iain?
Yeah, I mean, I think one of the things that John talked about was the importance of understanding your projections of budget. And I think there's something about making sure you've got good financial monitoring systems in place in order that you can spot some of the trends earlier. And I'm going to kind of slightly side sweep to another question, because I think I noticed earlier on, I think Sandra asked a question around if you're wanting to kind of shift the spending pattern on all those disabilities, how do you create, have you been able to create investment in prevention? And I think that's a really important question. In some ways, the majority of our working age adults are usually with a learning disability or a physical disability. There is some mental health in there. And in one sense, as a social care department, we probably know most about learning disability. So what we need to think about is how we work with those people through transition. And I think often practice has been to talk about preparing people for adult services as opposed to adulthood. And I think we've kind of lowered people's expectations, and we put people into what I describe as service land. So in order to create the investment in prevention, what we need to do is think about how do we reconfigure things like day services and prevent and introduce different offers. For example, we do things that are described as called project search, which is helping people with learning disability gain access to employment. Because actually, if we can help people be economically resilient, their physical and emotional well-being is dramatically improved, and that sense of tying in people to a service for the rest of their life. Actually, we've had some really amazing success stories. So there's something about how we use our current expenditure in services that maintain people in services, and how we reconfigure those to doing some different things around engaging people in developing their skills, work experience, volunteering, and hopefully into employment. Appreciate that we might have quite a challenging economic period that we're going to be going through with post-COVID, but actually I think there are a lot of employers, and certainly the conversation we've been having in Calderdale, where employers really want to embrace supporting people with a range of disabilities.
Hold a second. Thank you, Ian. And just not to pick on you, but I just had one other question, which was about the skills and capabilities of the workforce. So what are the 2 or 3 things that are really getting in most in the way of people being productive strengths-based practitioners, spending a lot of time with people in communities? What's really getting in the way? What are the 2 or 3 things that strike you?
I think when we talk to practitioners, I think they get the whole concept of the strength-based conversation. I think the challenge that is to give people time to understand what's going on in their patches and really connect with what's going on, because some of the activity that you might connect people to may not be through your larger, more organised third sector organisations, but it might be a faith group, it might be a different group that's running in a community. So there's something about knowing your patch and being able to connect people to it, just in the hope that I can put a smile on John's face. For our social workers, I do think we need to help them be financially literate, and to understand the kind of concept as they're developing the conversation, the strength-based conversation, and thinking about the interventions that will best help that individual deliver the outcomes they are choosing to identify. Is they do need to be aware of the costs of those things. And I think often if people support plan incrementally, sometimes they don't get the full picture of what an annual cost of a support plan might look like. So I don't think that is something that finance should be doing for us. We need to use our finance managers and officers to develop that skill in social workers. And often I'm a social worker myself, I'll hold my hand up, will often describe coming into social work, we weren't motivated by looking after budgets, but in order to help people make the right informed decisions, we do need to understand what the cost of a support plan is in order that we can make ourselves more financially resilient going forward. So I think we do need to skill people up in finance. I think there's a conversation between our social work assessment staff and what we want out of our commissioners. And I think there is a skill set in commissioning that needs to move to outcome-based commissioning, but able to have quite deliberative conversations with a range of partners on your patch. And again, I've been a commissioner, so I'm holding my hands up to that, is sometimes commissioners are not necessarily relationship orientated, but actually what we need is a set of skills that actually build relationships with the third sector, that build relationships with communities, that have a really constructive dialogue about how we can work together. And so I think there's a skill set challenge for commissioners there, I think, as well.
Thank you. So I've got a question that's coming. I think it's best that maybe John answers this, and it's about forecasting demand. We're likely to see demand not only grow but probably change in the nature of that demand. So from a financial perspective, how important is forecasting, John, and what's your thoughts on how we do that very effectively.
I think, I mean, forecasting is key, to be honest. I think the days have gone of when you get to the end of a budget cycle or end of a budget year and find out you just overspent. Those things that can't happen nowadays. The amounts of money that you're spending are too large. So I think what you have to do is to spend more time forecasting up front and making sure that you've got the tools there in order to enable you to do that at a regular period. It's about having timely information. And one of the things that we've noticed is that treasurers or finance section 151 people, chief executives, are keener now to understand how social care operates. So you've got them half on your side to start with, and therefore use it, and take advantage of that going forward. You know, it is the biggest part of their operation. So why wouldn't they want to support you? You know, it is changing, and we certainly are seeing that changing, because people are going more to a business partnering than you know, an accountancy control type model. And I think just to pick Ian's point up about social workers in the front line, I think it is useful, it is imperative rather than useful for them to understand the cost, because by doing that, they can look to maximise the amount of care that they can provide out of their limited budgets. So it may be that they will take a decision not to provide something that's quite expensive, because they can get better, wider support if they do something slightly different. Unless they know the costs and understand the financing, they won't be able to make those decisions.
Thanks, John. So I've got another question for Iain, this time from Judith. And it's about how have you been able to engage with the private, independent and voluntary sector in terms of the commissioning agenda, given that they're actually very often in competition with one another? How have you sort of managed to balance off those different interests?
I'd like to say the answer's really quick and simple. I arrived in Calderdale as head of commissioning in 2013, and one of the conversations I had with a range of providers who'd been on the patch for some time, I kind of wanted to meet them so they could get to understand me and what would the way I wanted to work. And I'd said to the officers, I wanted a meeting that had no agenda, and I wanted to find out what it was like to be a provider in Calderdale. Officers were really nervous and didn't really want to have that conversation. They wanted a structured conversation. I went into the meeting and I had officers on one side terrified, and I had our providers on the other side thinking it was a trick question. So there was this long silence, and it struck me at that point that one of the things that maybe we'd fallen into, and I don't think Calderdale was unique, is that because of the way commissioning had developed and that we'd often raced to the lowest price, we'd forgotten that actually social care is about a respectful and relationship, and actually they needed to feel part of the solution. And so I think over the years we've worked to build that relationship, and whilst there are contracts and there is competition, what we've also been able to do is create collaboration across the piece. I hold, throughout COVID, I've been holding virtual conversation with all our registered managers and owners of businesses every 3 weeks, just to talk through their current challenges. I think we have to be prepared to take the conversation to providers. I think we have to be prepared to hear things that we don't always want to hear. And I established some roles in Calderdale that I think are relatively unique. So we developed these things called business relationship managers. So they weren't your contract quality people, they weren't your safeguarding, they weren't your commissioners, but what they did is they'd worked in the sector, they'd run organisations in the sector. The provider sector was involved in recruiting them with me, and they manage that real difficult interface about the real problems that they're trying to struggle with. I think what we need to recognise is there's often enough work there for all our providers, and we can reduce the sense of competition if we create collaboration. And I think there's no quick way to do it, but it is about a mindset and a behaviour and wanting to have collaborative relationships at the heart of it.
Thank you, Ian. So I've also got a question here from Mike, and it's about strengths-based approaches, and in particular he's concerned that we ensure that strengths-based practitioners work collaboratively with people who use services, because at the moment practitioners still hold the money and they still hold the power, and if they're not working collaboratively with people, it really can become imbalanced. So I think my initial response to that is that the critical review tool, the diagnostic tool I referred to earlier, does cover power dynamics as one of the key set of questions, and it looks at co-production, which is a concept we hold dear at SCIE, which is about practitioners working in equal partnership with people who use services and carers to decide what the person who's receiving services most wants and needs. So I think it's important to train and develop staff in co-production skills, but equally it's important for leaders to model strengths-based approaches. So to model a willingness to support people to come to joint decisions about what care and support they need, and to also let go a bit, not chase short-term outputs. How many assessment forms are completed within the shortest possible time, but actually start to measure improvement in terms of outcomes. Are people's experiences improving? Is the quality of practice improving? So I think that's my two thoughts on that. Anyone else want to come in? Maggie, do you want to come in on the question about strengths-based practice, or Ian?
Yeah, no, I'm absolutely agree with you. I think it's important, isn't it? Going back to my point about actually having mature relationships and not being over bureaucratic and not kind of driven by the commissioning kind of approach that has always been in the past. And actually, how can we pull the resources, how we can pull the finances to basically harness those resources and deliver the best outcomes. And I think, so much of that, I think Ian touched on it as well, is about kind of changing our approach that is kind of, very much more to that kind of working in partnership and using people's skills where they are best placed. And actually that will help the pound go further.
And just to build on that, I mean, what's your view, Maggie, on how we kind of balance that tricky choice between giving people more choice and control and stabilizing the market that's under quite a bit of strain at the moment due to COVID? So how do you kind of balance choice with market stability? Any thoughts on that?
That's quite a hard question.
Sorry about that.
No, and I think it would be interesting to get others' views on this. But I think, going back to my point about the fact that actually, as commissioners, we have to look at flexible models and we have to work with providers to develop flexible models. But I think sometimes there is that really tough, difficult decision that we can't ensure that every single provider will survive, because we do not have the finances to do that. And that actually, where we can work with providers to reconfigure their offers. So, for instance, very much in the thought at the moment is moving away from the residential to more community-based. How can we use those resources to support extra care and more complex kind of extra care? But actually, we're going to have to work with providers, and they are going to have to be quite flexible in terms of being able to tailor the services to what the community needs, rather than looking at economies of scale and a blanket approach that may not fit. I mean, as Ian was describing Calderdale, there are many different areas in Calderdale with very, very many different needs. And some of the big, we look at some of the big county councils, you cannot just have one provider who just wants to provide one thing across the patch. And that's going to be the struggle for them, because they will kind of push back in terms of economies of scale, etc. But I think it's about working with them to develop that sustainable business model, and where we can direct people to them who have got personal budgets, who are self-funded. And so I think it is going to be really kind of close working to look at how we can reconfigure.
And I think, Maggie, if I can just come in there, I think it's also about ensuring that you make use, or social care professionals make use of the finance support that they've got, so that, you know, when they are talking to providers, when they are talking about getting the most for the money, and they're looking at the costs and how the providers are justifying costs, it's always useful to have a financial pair of eyes in there who've looked at it in different ways before to support the social workers, to be perfectly frank. Because you are both got the same aim, which is to get the biggest bang for the pound that you've got.
Yeah, absolutely.
Thanks, John. So I'm aware we've got 2 or 3 minutes left, so do ask. We've got probably time to take 1 or 2 more questions, so do send those questions in, and we'll try to answer them. Ian, anything you want to? Oh, here we got one from Rachel. So in relation to enabling person-centered outcomes alongside choice and control, has there been any significant shift in the promotion or adoption of integrated service funds? I think you're talking about, and direct payments in Calderdale. Also independent service funds, I should say.
Yeah, individual service funds.
Yes, finally got it. Yeah, thank you.
Yeah.
Anything on that you'd like to say?
So we did quite a lot of work, and we do have a lot of people on direct payments, and as part of an historic contracting piece of work of actually a home care from about 6 years ago, we did generate a lot of work around potential individual service funds. And I think individual service funds are a really valuable tool in our armoury. I think probably what we didn't do first time round, and I think we always need to reflect and think about how we can do things differently, is we didn't necessarily work with the market to think about how different they needed to be a true individual service fund provider. I think, and I think it probably talks to what Maggie was talking about earlier, and I think in my presentation, if I didn't talk about market position statements, I apologise, but I think I did, is we have to have a conversation with the market about what the future might look like that starts that dialogue to think about how different they would be. And I think what we did with our individual service funds is use them as a default mechanism to deal with people who wanted to stay with their existing provider. It wasn't really embracing the true ethos of individual service funds. So we're taking a look at how we can bring those back, but work with the sector to be true individual service fund providers, because I think that's how you create real choice. I think we also have to be really realistic with the market about the kind of things that will happen. I think Maggie's referenced the shift away from residential care. In Calderdale, we have an oversupply of residential care, and that was pre-COVID. So we need an honest conversation that we will need residential care. It will always be a feature of Calderdale, but be realistic about the amount that we need in order that we can then bring in people who want to develop extra care or more community provision. So I think it's having that dialogue as early as possible with people and recognising the market will adapt and respond, but they'll need time to do that. They'll need a lead-in period.
Okay, well, thank you. I'm glad you answered that question. That was a really good answer. Thank you, Ian. Okay, I'm aware of the time. I think we're almost up in terms of our time. So I'm going to just take this opportunity to thank the excellent panel today for all your contributions. It's been really good doing this with you, and I'm really pleased with the quality of conversation we've had, I think. So thank you very much to the panel, and thank you all for taking part in the webinar. We hope to see you again in the near future. Thank you very much, and goodbye. Cheers.